My patients ask me, what do the stars do? I want to do whatever J-Lo or Jennifer Aniston does to look young and gorgeous forever. When people ask me, what do the celebrities do to stay looking young forever? And my answer is always the same. They do lots of little things all the time, and they started early. Unfortunately, there's no magic wand. There's not one thing that works for everybody and makes everybody look great forever. When you age, there are several things that happen at once. If we start with the skin, for example, you start to lose collagen and elastin in the skin, and over time that leads to thinner skin that appears more wrinkly and crepey. It develops brown spots. All these changes are made worse by sun exposure. So the number one thing I would advise people to do from a very young age is to protect your skin from the sun. And you can either do that with good sunblock. A lot of makeup will have good sunblock in it, but also doing things like wearing hats, avoid go tanning or laying out on the beach all day. The next thing I would recommend is to use good skincare products. The two things that I would recommend is something that has a retinoid in it, ideally prescription retin A. If you can't find that, then you can try over-the-counter retinol, which is a little gentler than retin A. The other thing I would advise everybody to do is make sure that you exfoliate, preferably at least once a day, with something that has either glycolic acid or salicylic acid in it, and little beads that help to take off the dead skin cells. Then the third thing is to do things that we do at our practice. Use technology to kind of build the collagen back up, and to reduce brown spots and to reduce wrinkles. You can do that with several types of technology. Lasers is one way to do it. They mainly treat the upper layer of the skin, and depending on what type of laser you use, you can either focus on treating more brown spots and pigment or treating more texture like fine lines and wrinkles. The next type of technology that you can use is called microfocused ultrasound. It uses a device that creates these tiny little injuries into the skin, and but it bypasses the top layer of the skin. So most of the times you don't have any downtime with these types of procedures, and it basically stimulates the body to make better collagen, and it plumps and firms the skin. Another form of technology to improve skin quality is called radiofrequency, also known as RF. Basically what it does, it heats up the skin and stimulates the body to make collagen, kind of similar to the microfocused ultrasound. It comes in different devices. Some have needles, some just use surface heating. The next thing that happens when you age is that you start to lose volume in your face. And that happens through two different processes. One is you start to lose fat in the face, but at the same time, that fat sometimes gets distributed to other areas. Like for example, when people start getting flat and hollow cheeks, but at the same time, they get these heavy jowls. Another thing that happens that creates volume loss is that actually the bone starts to remodel. When you look at the skull of a young person versus an old person, you can see that the eye sockets, they become bigger and they kind of turn a little bit, and that's why you start getting a little bit of drooping of the upper and lower eyelids. You also get recessing of the bone in this area, and the jaw bone is where a lot of the dramatic changes take place. It actually starts to shift forwards and at the same time kind of shrink down. And that's why a lot of people start feeling very old in this area when all that happens. This starts kind of late in your 40s, I would say in the middle of your 40s, but usually it's by your 50s and 60s where it really becomes very apparent. Unfortunately, there's nothing you can do to prevent bone loss or fat loss and redistribution in the face. However, you can use fillers to restore some of that volume loss. When you start early, when you're having just a little bit of volume loss, it's much easier to kind of keep up with it than when you wait, when you're very hollow and sagging. Trying to restore that with fillers is very difficult to do, it's very costly, and tends to look unnatural. When you look at celebrities, they don't wait till they look very hollow and very saggy. I mean, they just continue to look good, and that's because they frequently use small amounts to not really change their appearance that much, but just kind of keep up with how they used to look. And then finally, you have the muscles and ligaments in the face that change with aging. And two things happen with that. On one hand, you become loose and kind of like lax, almost like stretched out rubber bands. And on the other hand, some of the muscles become hyperactive, like for example in the chin or around the eyes. And for those hyperactive muscles, you can use Botox. It basically relaxes the muscles and prevents them from contracting too much. And that's how you can get the effect. Botox really doesn't cause big changes in the face. It just makes you look more refreshed and less angry or sad looking. Unfortunately, for the other part effect that happens to your muscles and ligaments, the fact that they become more saggy and more stretched out, we don't have any great non-invasive treatments for that. For most people, if it's really bad, they really need a facelift where they tighten those muscles back up. However, if you have mild muscle laxity or even early moderate, or you're trying to prevent muscle laxity, I really think that Ulthera works very well for that. It uses microfocused ultrasound to create these little injuries in the muscle layer, the same layer that is being tightened during surgery. And those little injuries stimulate the muscle to kind of tighten a little bit and slow down the aging process. So unfortunately, there is no magic wand. If there was one, I would have it. The best advice is to do lots of small little things, to start early and do it on a regular basis. If people wait too late, they're often disappointed by what we can do non-invasively. It's much better to treat early and to prevent and maintain than to try to reverse significant changes. When you look at the celebs, they don't wait till they look really bad. They just maintain looking good by doing small little things. So if you're interested to see if any of these treatments would work for you or what we would advise, please give us a call and set up a free consultation with any of the physicians here.